Hi, Mrs. Perry, it's Vicki, your CNA, and I'm here to clean your dentures. I'm going to get started on doing your dentures, Mrs. Perry, but first I'm going to sanitize my hands, covering all surfaces until completely dry. Okay. All right, so I'm going to get started here. I'm going to need emesis basin and denture brush and denture paste, a pair of gloves, and a washcloth. I can use a barrier towel if I wish, but it's not required, so I'm gonna leave it out. So I'm gonna take your dentures now, and I'm gonna go to the sink, and I'll be right back when they're done being washed. So I'm headed here to my sink to do my denture care and clean those dentures. I'm gonna put on my gloves. And I'm going to use cold water. I never use warm water for denture care. It's cold water. State Board requires it to be cold water. I'm going to line my sink with a washcloth or a towel. I'm going to use a washcloth so that should they slip out of my hands, it prevents breakage. I'm going to take my denture out and put it in my emesis basin. Some denture cups have these little strainers. If it does, just take it out. You can reuse it. I'm going to empty out my old water and rinse my denture cup. And fill it with clean, cool water. Now if I have one of these little strainers, I can reuse it. It's not required for State Board, but if you have one and it's in there, just also rinse it and put it in the denture cup and it's ready for you. I'm going to put denture paste on my denture brush. This is called a denture brush. I'm going to take my denture. For State Board, you only have to do one denture, either upper or lower. This is the upper. So I'm going to wet it and I'm going to scrub all the surfaces. Notice how I cup the denture just so that I have more security in holding on to it better so it doesn't slip out of my hands. Continue to scrub the inside thoroughly. I can use the other side. This is for more deeper grooves, the other side. Again, I continue to cup my denture, scrubbing all the surfaces in between the teeth. Again, for State Board, you only have to do the upper or the lower, not both. But in real life, you might have to do both. All right, now I'm going to rinse my denture. My denture is thoroughly rinsed now, and I'm going to put it in my clean and rinsed denture cup. Now I'm going to rinse my equipment. I'm going to rinse my denture brush. You don't have to rinse the paste, but if you do, it's not a big deal. No points taken off for that. I'm going to rinse my emesis basin and close my water now. I'm going to dry my supplies. Paper towel is fine. You don't need to use a barrier towel for this, but if you would like to, that is absolutely fine. I'm drying my denture brush, putting my denture paste in there, getting rid of my paper towel. Now, I have to take my washcloth out of the sink, wring it, and put it in my laundry basket. Now I'm going to remove my gloves, disposing them in the trash can. I'm going to take my denture cup and return my supplies to the bedside and put my dentures at the bedside. Okay, Mrs. Perry, here are your dentures. They've been brushed and they're there at your bedside. I'm going to put my supplies away. And here's your water and your call light within reach. And I'm going to sanitize my hands and let me know if you need anything. sanitizing all surfaces until they're completely dry. Skill complete.